I'm Dr. Justin Boey, Medical Director of Sozo Aesthetic Clinic based in Singapore. Today, we will explore a little bit more about dermal fillers. Dermal fillers are injected substances that are placed beneath your skin to volumize, lift, or create more projection. There are two types of dermal fillers. The first type is hyaluronic acid based fillers. The second type would be biostimulatory or collagen stimulating fillers. Hyaluronic acid based fillers are primarily used to create very specific changes to the skin or to the face, such as creating projection or volumization. Collagen stimulating fillers, on the other hand, are used to create more general changes to the skin, such as stimulating the body to produce more collagen throughout the entire skin area that's been treated. Fillers can definitely be combined with other lasers and energy-based devices to create a more complete improvement in our patients. If done on the same day, you should be doing lasers or energy-based devices before you are doing your injectable treatments. There are two important things that you should avoid after getting your filler treatment. The first of which would be to avoid alcohol and to avoid exercise for the next 12 to 24 hours after your treatment. The second thing to avoid would be to avoid deep massage over at the treated area for at least 3 to 5 days. Patients often ask me, "Doctor, are dermal fillers risky or dangerous?" The answer is, well, dermal filler treatments are medical treatments after all. Hence, the risk should not be trivialized. There are 3 possible common but mild side effects when it comes to filler treatments. The first of which would be needle-related side effects such as pain, bruising, swelling during the treatment itself, as well as the subsequent days after the treatment. Rarer side effects would include infections, biofilm, or granulomas. However, this tends to be due to inferior product usage, incorrect placement of the product as well. Filler treatments are one of the most commonly performed treatments in the field of aesthetics. However, there are certain rare risks that are quite serious. This would be vascular compromise. This means that the filler product has entered into a blood vessel and has blocked off the blood vessel. This results in certain complications to the end organ that the blood vessel supplies. For example, if the blood vessel supplies the eye area, the patient might end up having visual deficits or blindness. If the blood vessel that's affected supplies skin, there might be skin ulceration or necrosis. This is why it is very important for patients to go to an experienced injector who has very good knowledge with facial anatomy. The second important thing is also to have your treatment done in a reputable and well thought out facility that is able to handle and manage such complications. We will be dispelling myths with regards to filler injections. One of the most common questions that my patients ask me is, will I look saggier after filler injections? The answer is no. This is because for filler injections, we rarely inject so much volume into the face such that it stretches your skin. Hence, it is very rare that you will look saggier after a treatment. Another question that I get asked quite often is, "Doctor, will I look fake or will I look puffy or fat after having filler injections? The answer is, it depends. If you go to an experienced injector who has the same aesthetic goals as what you have, in general, you should look refreshed, but not fake, not overly filled. However, if you go to a doctor who is not so experienced or who has slightly different aesthetic goals than what you have, you might look a little bit different than what you hope to achieve. When it comes to how long fillers last, it really depends on what type of fillers you've had. Hyaluronic acid fillers can last anywhere from 6 months to 15 months, whereas collagen stimulating fillers might last anywhere from 18 to 24 months. Do note that it is not rare to have fillers that last beyond that duration of time. Another question my patients ask me is, "Doctor, will I need more and more fillers over time?" Well, yes and no. In the short run of 1 to 2 years, you should not need a vastly increased amount of fillers. However, as you age, you do lose collagen as well as bone at a rate of 1 to 3% per year. And over decades of your life, eventually you might need more and more fillers to replace the volume that you've lost over the decades and the years. Doctors themselves always ask me, what makes a good filler injector? For me, I believe that there are 3 key points. The first of which would be someone who is very familiar with the products that he's using. This is because there are so many different products out in the market, and for each brand, there's a very wide range of products that can be used for different areas of the face. Hence, to achieve optimal results for your patients, doctors should be very familiar with the products that they are using. The second important point would be to have good hands. Similar for pilots, for surgeons, it is very important for filler injection doctors to have a good pair of steady hands. But most importantly, I feel that a good injector should have a keen aesthetic eye. This might mean different things to different people. I feel that a good injector is someone who can communicate his vision and his goals very well to his patient, and is able to combine what the patient wants to achieve a shared aesthetic goal. This to me is the most important factor amongst the 3 for what makes a good injector, as well as what can eventually lead to a very satisfying aesthetic journey. I generally have 2 guiding principles. The first of which is less is more. What this means for me and my patients is that I would rather be conservative when it comes to treatments, and I would prefer to slowly scale in to the different types of injectables, as well as even lasers and energy-based devices. This allows my patients to see the results and to be comfortable with the whole journey that they are embarking on. So less is more is a very important philosophy for both myself and my patients. The second important thing that I hold strongly to is patient choice or patient autonomy. I strongly encourage all my patients to have a sense of what they would like to achieve before they even step into my clinic. This is because you should have your ideal aesthetic aspirations before you even see a doctor. This allows me to match my patient's aspirations with my aesthetic injection skills in order to achieve an optimal outcome for my patients. One common question that patients always ask is, what is the price of filler treatments? How much should filler treatments cost? In Singapore, it is very common for doctors to charge based on per syringe prices. The prices of hyaluronic acid fillers can range from $650 to even $1,000 per syringe, depending on the type of fillers that they are using. As for biostimulatory fillers, it can cost anywhere close to $1,000 to $2,000 per syringe. However, I always tell my patients that you are not paying for the syringe primarily. You are paying for outcomes and results. So always go to a doctor who is able to have a shared goal in terms of your aesthetic journey. This matters more than just price alone. One question that patients ask me is, Doctor, what are your most memorable filler experiences? I remember when I first started out, one of my most memorable experiences was treating a 40-year-old lady who was at the prime of her career. Unfortunately, she didn't look the way she felt. She was a high-performing, energetic, and athletic lady who was at the prime of her career. But what she saw in the mirror is someone who was tired and burnt out. When she came to see me, those were her exact words. And what we did was a bit of filler rejuvenation at her cheeks, her under eyes, as well as her temples. Instantly, she felt a lot better. She finally looked the way she felt. This to me has impacted the way I view aesthetic injections, because they can make dramatic changes to a patient's face and to their lives.